All right, 17. Mastoiditis involves what cells? Mastoid air cells. A slow-growing, locally aggressive benign tumor. What should you have on the differential that starts with a D? Desmoid tumor. So if you're in the hospital, in the ER most likely, someone has a trauma, their extremities are involved, they're having some sensations of tingling and ant crawling. What should you be concerned about? What syndrome? Compartment syndrome, right? All right. If you are at a pediatric clinic, you have a concern for delayed puberty in a male. What basic 3 lab tests should you do? FSH, LH, and testosterone. All right, get this. To interpret trends on graphs, you should look for measures of what? Statistical significance, right? Look for statistical significance. Hypertrophism after pregnancy with non-tender goiter you should be concerned for what condition? Postpartum thyroiditis, for hyperthyroidism after pregnancy with a non-tender goiter. So you're with your patient and you know that they have a myocardial infarction. So what does their treatment regimen of Monabash mean to treat this in STEMI? Monabash means morphine, oxygen, NO, aspirin, beta blocker, ACE inhibitor, statin, and heparin. Is it ethically safe to prescribe medications to your family members just because they ask for whatever? Definitely not. It is ethically unsafe and unsound to prescribe medications to your family. Okay. So you have a patient, they have dilated pupils, they're tachycardic and hypertensive, and they're sweating. They have insomnia and decreased appetite and increased irritability. What should you be concerned for? Signs of stimulant toxicity, right? True or false? Sinusitis can be caused by secondhand smoke. That's definitely true. Sinusitis can be caused by secondhand smoke. If you're talking to your patient or someone, is it a good statement to say something like this? I respect your decision. Hospice will be available if you return. Yeah, that's something fine to say. What are the only 2 requirements for hospice care for the most part? 1, that they have less than or equal to 6 months to live, and that the decision is made by the person with legal right to make such a medical related decision, right? Like a power of attorney or the person themselves for the most part. Now, you have a patient with an abnormal chest x-ray that needs sputum culture, sputum smear, and NAAT, right? With that abnormal chest x-ray, not culture, they have an abnormal chest x-ray. So you have this patient with an abnormal chest x-ray. They need a sputum culture, sputum smear, and an NAAT. True or false? Sputum smears are often false, negative. That's true. So you got to keep an eye out for that because sputum smears are often falsely negative. The person might actually have some sort of infection, but the test will indicate that they do not. So, if you suspect biliary colic in your patient, what sort of imaging should you do, like quickly, that's cheap? Do an ultrasound of the abdomen if you suspect biliary colic. You know what I mean? Now, if you have a patient with biliary colic, they can have mainly 2 things for the most part. They can get pain meds and or an elective cholecystectomy, right? Right. Now, in the common bile duct, you have stones. That's called choledocholithiasis, and it causes prolonged biliary colic and cholestatic liver function test abnormalities. So how do you treat that, basically? An ERCP can treat choledocholithiasis. If you have a patient with Hashimoto with rapidly enlarging goiter, what should you be concerned for? A thyroid lymphoma, right? Be concerned for a thyroid lymphoma. If you have a patient with acute decompensated heart failure that can be treated with IV furosemide, what? I gave you the answer, right? So what can you treat acute decompensated heart failure with? IV furosemide, right? If acute decompensated heart failure is not fixed by IV furosemide, what medication that starts with an N can you try? Nitroglycerin. Now, if you have a patient with acute decompensated heart failure that is stable, what sort of echocardiogram should you do? Do a transthoracic echocardiogram. What are basically some things regarding transfusion reaction times? So I'm going to say the time frame and you tell me what it is most likely. Seconds, anaphylactic. Hours, acute hemolytic. Several hours. That's a lot. Taco, trolley, urticaria, febrile, non-hemolytic, and TTBI. And what if it takes like 2 to 10 days? You know that's delayed hemolytic, right? Don't even play with me right now. Now, if you're in your derm clinic and someone comes in, they're like, Doc, I got this bald, circle-ish lesion. The patient wouldn't say that unless they were in the medical field, and they are. So they're saying, Doc, we got this bald spot. It's a circle. There's no hair growing in it. What should be at the tippity top of your differential? Alopecia areata on differential diagnosis. Don't play with that. Don't even play. That's not even a joke. And how do you treat alopecia with what medication? Intralesional corticosteroids, right? Treat alopecia with intralesional corticosteroids. Now, true or false? Phototherapy to treat unconjugated hyperbilirubinemia in kids or an exchange transfusion if greater than or equal to 25 milligrams per deciliter. Is that sound treatment? Definitely is. Now let's follow this up. You want a phototherapy follow-up Q4 to Q6 hours, right? Definitely do. Now let me hit you with this. What's the threshold for exchange transfusion in an unconjugated hyperbilirubinemic kid? We're going to go with 25 milligrams per deciliter, but keep in mind it could be 20 to 25 milligrams per deciliter. Now you have a kid with a pediatric neck mass. What's the differential diagnosis? 4 main things. Thyroglossal duct cyst, dermoid cyst, brachial cleft cyst, and lymphadenitis. So let's say you have a newborn patient with trisomy 21. What imaging thing should they have done pretty soon? Echocardiography for sure. You got to look at that Down syndrome heart, no doubt. Now, patients with Down syndrome are at increased risk for what sort of leukemia? Acute leukemia. Patients with Down syndrome have increased risk of acute leukemia. If you have a patient that has concerns of constantly blinking and clearing their throat, what should be on the top of your differential? Tourette syndrome, right? And what medication that starts with an R is used to treat Tourette syndrome? Risperidone. You use risperidone to treat Tourette syndrome. Now, you have a patient with small cell carcinoma. Is that associated with a sort of condition that throws off osmolality? Definitely is. It's associated with SIADH, that normal volemic hyponatremia. And how do you treat SIADH from a sort of behavioral intervention standpoint? Water restriction. What virus causes slap cheeks? Parvovirus B19 causes those slap cheeks. Patient will have flu-like symptoms and a viral arthritis, right? And this viral arthritis, secondary to parvo itself, is limited, and there are not long-term consequences for the most part. Now, a patient with atrial fibrillation that needs antiarrhythmic therapy, how do you treat them? With amiodarone. Now, if you have a patient with streptococcal pharyngitis, how do you want to treat? With oral amoxicillin. How do you treat pelvic organ prolapse? With a surgery or pessary. How do you treat recurrent polymicrobial bacteremia in a patient with no health issues? Wait, take that back. So you have a patient with recurrent polymicrobial bacteremia. How do you, with no, that. You have a patient with recurrent polymicrobial bacteremia. This patient doesn't have any health issues. So what should you be concerned with? Factitious disorder. Factitious disorder. That's it. Adios.